Hello, my name is Dr. Melissa Chiang, and I'm a board-certified dermatologist at Integrated Aesthetics. And I decided I wanted to film a series about acne because acne is so common. It affects so many teenagers and adults as well. And the thing is, we have really good treatment for it. I'm going to begin this series by talking about what is acne, but then also what happens when you go to see a dermatologist for acne. And then what we're going to do is we're going to film other videos, and as we do, we'll add them to the playlist. So the first thing to get out of the way is, what is acne? And I think most of us will recognize it when we see it, and it's so common. But the way a dermatologist thinks about it is, acne is a condition of hair follicles. And what happens is the hair follicles get filled up with debris. And that debris consists of sebum, which is oil, bacteria, skin cells, and sometimes there's some surrounding inflammation. And there is, in the clinical presentation, ranges of severity. So sometimes it's just tiny little bumps, sometimes it's red bumps, sometimes it's pustules, sometimes there's deeper nodules. But generally speaking, in acne, there will be a range of lesions in all different stages of evolution. Those are the characteristics of acne. So one of the important things is, when can you treat it at home, or at least try the first few steps at home? And when should you go in and see an expert like a dermatologist? Where I think the dividing line is, if you have little tiny blackheads or whiteheads, which are either they look like open pores or they're little bumps but they don't have a lot of redness, that is fine to try to treat at home. As soon as you're getting some inflammation, if the inflammation is superficial, which just means on the surface of the skin, you could also try initially to treat that at home. But as soon as inflammation gets deeper, or if you're getting bigger pimples or pimples that hurt really bad, that's a sign that there is a lot of damage going on in the skin. And the one thing that is so important with acne is that when it's in the inflamed state, it is treatable. We can prevent acne from coming with medications, but once you develop scarring, that's a whole different ballgame. And I know that myself and my dermatology colleagues, our goal when we treat acne is to prevent scarring. So I know the next question on your mind is, what can be done at home? And actually, there are a lot of effective acne treatments that are available. And so if the acne is strictly blackheads and whiteheads, what we're thinking about is topical treatments. And we have topical treatments that are over the counter. We do have prescription strength as well. But what I would recommend you start with is, number one, a gentle cleanser that you would use at least every evening, but potentially, depending on your predilections and habits. I know teenage boys sometimes have a harder time doing twice a day washing, but a gentle cleanser at least at nighttime and maybe twice a day. Secondly, starting a retinoid. And actually, starting about maybe 10 years ago, adapalene became an over-the-counter retinoid. It went from prescription to over-the-counter, and you can find that under the name adapalene, Differengel, Effaclar. It's available in your drugstore, grocery store, Amazon. But what retinoids do is that they help to prevent the follicles from plugging up. They make those skin cells that we said are compacted and plugged into the hair follicle, they make them loose so that they can get out through the top and prevent new pimples from coming. So I love adapalene. The problems with adapalene that sometimes make people stop treatment is, you might develop a purge between weeks 2 and week 6 after starting adapalene. And so that's something that, as long as you know that at the end of that, you're going to have clearer skin that doesn't break out as much, hopefully you can get through that. Secondly, over the counter is benzoyl peroxide, and that has the potential, I would say, to be the most irritating of our acne medicines. So I especially like it if you are getting an occasional red bump and you kind of know when it's coming. You can start putting it on that bump. If it's a gel, you just put it on the bump and leave it there. If you would like to do a wash with it, you can use a wash as well. That's less irritating, but you need to leave the wash on for at least a couple of minutes before you rinse it off. Salicylic acid is another very common over-the-counter acne medication that you will find at your grocery store or drugstore, and that can be very helpful for exfoliating the skin cells on the surface of the skin. So those are kind of like the 3 ingredients that I would say can be very impactful for mild acne or just beginning acne, like the beginning of puberty acne. Try those because they can be very, very effective. If you have more than mild acne, or if you are trying these over-the-counter treatments and you're finding that you're not having much success with them, then I think it is probably time to go in and see a provider, because especially if your acne is distressing to you, acne is very treatable. And so what happens when you come into my office is, number one, I evaluate the type of acne that you have. Is it comedonal? Is it inflammatory? Is it cystic? And then we look at other factors. So male or female is a factor to consider because some of our treatments are geared towards females. And then the third thing I ask you are, what are your predilections for purely topical treatment or topical and oral treatment? And how aggressive do you want to be with your acne? And so we can make customized plans based on your preferences. When a dermatologist comes in to evaluate your acne, they are actually making sure that you have acne. So acne is super common. I think most of us think we can recognize it, but there are certain mimickers, and sometimes it can actually be challenging to tell the difference between acne and these mimickers. And they include rosacea. Acne rosacea is probably one of the more challenging ones to differentiate from acne. Number 2 would be perioral dermatitis. Number 3, sebaceous hyperplasia or enlarged oil glands. I frequently have clients who will come in and say, hey, I've got this acne, but it just never goes away, and it's actually not acne. And then there are some rare things that can cause little red bumps on the face, which again are not acne. So your dermatologist is going to make sure that acne is the thing that you have, but then they'll also do an assessment on your skin, because one of the issues with topical acne treatments, even though they are so wonderful at treating acne, is that they can make the skin barrier a little bit compromised, and that can cause irritation. And if you're not careful with that, that can actually lead to red flaky skin and even sometimes more breakouts. Sometimes it's really nice to have an expert who has seen many cases of acne and how acne responds, and also knows how to deal with skin that is inflamed. It's nice to have that person directing your care. And then once your dermatologist has decided that it is acne, if you are a female, generally speaking, we will be looking for signs that there might be an endocrine abnormality. And the most common one is polycystic ovarian syndrome. So that's characterized by acne, but there are some other features as well. They include male pattern hair loss, pubic hair that is more in the shape of a male pubic hair, which is more like a diamond versus a triangle for a woman, missing periods, so less than 8 periods a year. All of those would point us more towards polycystic ovarian syndrome, and that actually has a treatment that's more hormonal, birth control pills, versus like trying to do other things in the acne paradigm. Thank you for listening to this video, the first in our series. If you have any comments or questions, please leave them in the chat below, and I look forward to hearing from you. Also hit the subscribe button and the like button. Hello, my name is Dr. Melissa Chiang, and I'm a board certified... Hello, my name is Melissa Chiang, and I'm a board certified... Dr. Melissa Chiang. Oh yes. Hello, my name is Dr. Melissa Chiang, and I'm a board certified dermatologist at Integrated Aesthetics.